I'm Dr. Rod Kurthy, the developer of the KoR Whitening system. In the next few minutes, I'll go over all the information you need to know to get the maximum results from your KoR Whitening experience. First, it's important to keep your KoR Whitening gels in the refrigerator whenever possible. If you're traveling when whitening, keep your gels with you. Do not allow your whitening gels to remain in a hot car or other hot area. Each whitening gel syringe has only 5 mL of gel, so you are allowed to carry them on a plane. When you arrive at your destination, leave the syringes in your air-conditioned room. If you have access to a refrigerator, that's even better. Each night when you whiten, only insert your KoR whitening trays when you are ready for sleep. If you like to read or watch television in bed, please wait until after you're finished. The reason for this is that when you lie down to go to sleep, you naturally salivate less and you swallow less. And that is the very best environment for whitening. To get started, brush your teeth first and floss if you normally floss at night. Next, apply your KoR Teeth Desensitizer. For the first 2 nights of whitening, apply the desensitizer before whitening at night and apply the desensitizer again in the morning. After the first 2 nights of whitening, only apply the desensitizer every morning. Prior to applying the desensitizer, you should wash your hands thoroughly. Take one of the swabs and the squeeze bottle of desensitizer from your whitening kit and add drops of desensitizer to the swab until the swab is fully wet. Set the swab down on the counter with the wet cotton tip extending off the edge of the counter. To apply KoR Desensitizer, insert a finger deeply under your cheek and another finger deeply under your upper lip in one corner of your mouth, and firmly pull your cheek and lip as far away from your teeth as possible. Notice how the cheek and lip have been pulled far away from the molars as well as the front teeth. This is very important. With your other hand, quickly dry the teeth with a cloth or paper towel while you continue holding your lip and cheek far away from your teeth, and then pick up the swab. Starting on your front teeth, firmly scrub the sides of your teeth with extra emphasis next to the gum line. You do not need to apply desensitizer to your second molars, which are usually the teeth farthest back in your mouth. Also rub the swab into the biting edges of your front teeth. Next, add 1 more drop of desensitizer to the same swab and apply to another corner of your mouth, such as your lower right teeth. Follow this same procedure of adding 1 additional drop, drying the teeth, and applying the desensitizer to another corner of your mouth until desensitizer has been applied to all teeth. And then rinse your mouth gently with water. Properly filling the whitening trays is critical to achieving maximum whitening results because it ensures a proper seal of the whitening trays. Begin placing whitening gel in the upper tray. Please notice how much gel is placed in each tooth area. Do not apply gel to the second molar area, which is normally the last tooth. Start applying whitening gel in the first molar. Only place gel into the outer side of the whitening tray as you see here. The larger the tooth, the more gel you will place. Notice that you only put a relatively small amount of gel in each tooth. Continue placing the gel into the tooth areas until you reach the first molar on the other side. And of course, fill the lower whitening tray in the same manner. Insert the trays over your teeth and be sure to push the tray all the way over the teeth. The thick gel has pushed the sides of the tray away from the teeth a little. It is very important that you very gently push the tray back against the teeth until the edges of the tray contact the teeth next to the gum line. You should see just a little excess gel has squeezed out of the edge of the tray as the trays are gently pushed back against the teeth. If you see an excessive amount of gel, the trays have been overfilled. Adjust accordingly the next night. On the other hand, if you see no gel has squeezed out, Place more gel the following night. Wipe the slight excess gel off with a paper towel or just your finger. And of course, use the same process when inserting the lower whitening tray. When you get up in the morning, take your trays out and rinse your mouth thoroughly. Next, clean your whitening trays with cool tap water using a Q-tip in a rotating motion as shown in the video. Avoid using warm or hot water as it could affect the fit of your trays. Do not use the swabs included in your whitening kit for this purpose. And then shake the excess water off the trays. After you've thoroughly cleaned your trays, place them back in your tray case. However, if you will be whitening again that night, do not close the case. You want to be sure that the trays have fully dried before the next use. Then brush your teeth and floss if you normally floss in the morning. After brushing your teeth, apply the KöR Desensitizer as demonstrated previously. Getting exceptional whitening results depends upon closely following your dentist's instructions and the KöR Whitening at-home protocol you just watched. If at all possible, do not skip nights when you're whitening at home. Consecutive nightly whitening is the key to obtaining the very best result. During the at-home whitening process, avoid staining foods when you can. Foods to reduce or avoid would be any food or beverage that would badly stain a white shirt. Always handle your whitening trays with care, and make sure to keep your whitening trays out of reach of small children and pets, especially dogs who love to chew on whitening trays. When you are completely finished with your whitening treatments and you want to store your trays in the case, be very careful how you place the whitening trays in your case. First, place your upper tray in the case like you see here. Do not place them sideways like this, as it may permanently deform the trays. Then turn the lower tray over and place it into the upper tray as you see here. To enjoy a lifetime of white teeth while still being able to enjoy your favorite foods and beverages, discuss an ongoing maintenance program with your dentist. You may resume a normal diet and still maintain the whiteness of your teeth by wearing your whitening trays at home periodically as your dentist suggests. If you have any questions or concerns, just give your dentist a call. I'm sure you're going to be thrilled with your KöR whitening results. Thanks for watching.